the people who have been talking about this from the beginning only really have one setting at this point, and that is to be panicky about everything that we have that's new, to insist that we have to default to these policies that we all know don't work, including policies of lockdowns and mandates. They really only have one speed to turn to. And I think that that's something that they're doing in part because in order for them to actually be honest about what's going on, they would have to admit a number of things. They would have to admit that people who were early critics of the approach to lockdowns and preventing people from going back to work, preventing people
like
from being able to go to school, were wrong. That they were wrong when they were criticizing them for making that argument. That everybody who was saying, hey, no, look, we shouldn't overreact to this. We should do what steps are necessary, but that we should be very much aware of the negative downsides that could affect so many different people who are not at risk when it comes to this disease. They would have to admit that everybody who was making that argument had the better of it, and that they've been borne out by events that have come since. And I think that there's a real doubling down right now on the part of a lot of our leadership, particularly within this White House, that refuses to go in any way to admit that this was an approach that was wrongheaded and that there was any downsides to it. I think that's one part of it. I think the other part of it is that, frankly, these are a lot of people who are reading these poll numbers and understanding that the only area where they have any hope, where they have any level of significant support still within their response to any of the challenges facing America today, whether it's the economy, inflation, the border, our status around the world, the rise in crime, et cetera, the only area where they have any kind of support is on COVID response. And so because of that, they just are saying, look, we have to just talk. We have to talk this up as much as possible. We have to make everything an emergency in order to try to push through our agenda. And I think what we've seen the last several months shows that doesn't work either. Your threats don't work when it comes to threatening people about, treating them like an out group when it comes to getting vaccinated. And your threats don't work when it comes to trying to convince Joe Manchin to go along with your massive progressive economic agenda. And yet that's the only thing they keep doing. Brian, any smart, competent chief of staff running a White House could see that there is a lane for Joe Biden to get back to doing the things that he kind of sold himself on to the American people in the first place. What is that? It's by having, people who are at the center of the political debate direct the economic policy that he has, the economic agenda that he has, as opposed to listening to his left flank. It's about sidelining the panicky people like Dr. Anthony Fauci, who only have one setting on this thing. It's about basically insisting that we take on these teachers' unions organizations that have played so many games with our kids. These are all things that it is absolutely in the president's power to do, but he's not doing them because the White House, as I said, is just doubling down on all the things that haven't worked to this point. It's very short-sighted. It's a mistake. Right. And I think there's going to be a political backlash to it that they experience in the coming year.
Look, the pandemic was something that nobody was really ready to handle, and Donald Trump elects to dominate the political scene, tried to dominate the virus, and we are seeing now it's impossible. There's nothing we can do to stop it. There are things we can do to mitigate it, but most of all, we have to learn to live with it. So we were probably talking, Ben, I'm sure there's many there's tapes out there of you and I being critical of the Trump administration at times by the way they were doing things. But in retrospect, a year later, having learned from what Donald Trump did and didn't do, they're making the same mistakes, which I think is just unacceptable because they're the ones with the experience and pledged and promised to be better. For example, yesterday, Michelle Walensky said, we anticipated this. We knew exactly we anticipated this variant. The president has been moving forward today and announced a three-pronged strategy to surge the capacity in hospitals, to increase access to free tests, and to make sure that there's increased capacity for the vaccinations. She said they were ready for this. And then Joe Biden said, cut 5.
I don't think anybody anticipated that this was going to be as rapidly spreading as it did. The Omicron virus spread even more rapidly than anybody thought.
This is the same thing. And look at with Kamala Harris, before I give comment, it's the vice president too. Listen to Kamala Harris Listen, Kamala Harris comes out and says nobody anticipated the Delta variant. Okay? Wow, that's kind of honest. Sam said no one anticipated that. I didn't know that. So listen to Fauci.
I think that the vice president's statement was taken a bit out of context. I believe she was referring to the fact that the extraordinary number of mutations and amino acid substitutions, particularly with Omicron, no one had expected it that much, but we were well prepared and expected that we were going to see variants.
Right. The vice president didn't talk about the amino acids. So that was her big problem. So he went out of his way to say she was taken out of context. Shouldn't she be saying she was taken out of context?
Look, Anthony Fauci spends so much time spinning for himself. Now he's decided to take it on for Vice President Kamala Harris as well. I mean, look, this is a guy who seems to have spent so much more time trying to, and I think we're seeing now as the emails are coming out, go after critics of his approach, engage in this media spin as opposed to spending his time focused on what he ought to have been doing. And you mentioned earlier about the idea that we've been critical of both of these administrations. That's true, Brian. I think one area that you and I have both been critical is the need for additional, inexpensive, and widely available testing. This has been something that I've been beating the drum on for more than a year, that I'm sure you have as well. And the fact that we don't have that still at this point, that there are still FDA barriers to getting these types of tests approved, that there was such a delay from the get-go in the approach that was used, is a major flaw that is something that is absolutely laid at the feet of these health bureaucrats who have raised up so many different barriers at every point to prevent these types of tests from being widely available and inexpensive for people to get. The images of people standing in line in the cold to get tested are just abhorrent to me. At this point, we ought to be able to get these types of tests and have them widely available for everybody, regardless of your vaccination status. And that's something that I think we can absolutely lay at the feet of these bureaucrats, but that's why they have to spin this and say, oh, no, we were always prepared. We always were ready. We were on top of this thing from the get-go, even though the truth is that, as we will learn in the coming months and years, as we delve through everything that was going on, that they were caring a lot more about the way that their actions were being spun in the press than actually taking these steps that is under their responsibility in order to achieve that kind of approval. Exactly.
And why still to this day, I'll never understand why Anthony Fauci has to do every podcast, every TV appearance, when the guy should be, if he truly was a medical professional with this genius, with this powerful position, he'd be like Toscanini, directing traffic in and out, too busy to do one interview, let alone every interview. So to your point, that question came up yesterday, Cut 8.
Public health officials have been saying for months you need to surge rapid tests for just this moment. Is it a failure that you don't have an adequate amount of tests for everyone to be able to get one if they need one right now?
No, it's not, because COVID is spreading so rapidly. If you notice, it just happened almost overnight, just in the last month. But all of a sudden, it was like everybody rushed to the counter. It was a big rush. And I knew that was coming, so what I tried to do is meet with the companies and use the Defense Production Act to get 500 million more tests and figure out how to get them to their homes.
Yeah, I'm not sure that I'm even buying that. Does that really mean that we're not really waiting on lines for tests?
No, it's absolutely absurd, Brian, and the way that the White House has tried to maintain this fiction that they've been ready for everything, and that anything that it looks like we weren't ready for, it's because it came out of nowhere and no one would have anticipated it. It's as absurd as saying that no one anticipated that there would be chaos in Afghanistan, or that there would be any consequences to their border policy, or that there would be any inflation because of the economic policies that they pursued. The fact is that, as much as they might like to proclaim from the podium at the White House, whether it's Jen Psaki or the president, that, oh, well, no economist thinks that this will result in inflation. The truth is they're just ignoring everybody who they disagree with. And that's been true from the get-go with this White House. They ignore everyone that they disagree with. They try to bully you to come across the line and go along with what they want. And as I said, this has been proven to be as effective with Joe Manchin as it has been with the vast number of Americans who have not gotten vaccinated. Now, look, as you know, I'm in favor of people getting vaccinated. I'm opposed to using the power of the government to demand that they get vaccinated or force them to be vaccinated against their will. But I do think that this is a situation that the Biden administration has to look back on their first year and consider a failure. They did not shut down the virus. It has gotten worse, even with the power of having multiple vaccines, having multiple treatments, having a much better situation in terms of knowledge than the Trump administration had. They have handled it worse. They will continue to handle it worse without redirecting their energies and actually including some people in the conversation who don't just agree lockstep with everything that this White House from on high and these health bureaucrats from on high believe that we ought to do.
Right. And it was good that he complimented the president, gave him credit for his administration coming up with the vaccine. That was the first time. Why it took a year, I don't know. Well, I do know. But lastly, real quick, I want you to weigh in on the Build Back Better. James Carville said this about what we could look forward to in 2022. Cut 26.
Build Back Better, dead or alive, what do you think?
Build Back Better is dead, but Build Back Differently is going to be very alive after the first year.
Do you think so? Because the report that Joe Manchin actually put out a proposal that added up to $1.8 trillion that included universal pre-K, an expansion of the Affordable Care Act, hundreds of billions in green energy spending, which seems to have been rejected. Do you think that Joe Biden's going to go back there and just sign off on that? And would that be a disaster?
I don't think that he can, for a couple of different reasons. One of the biggest reasons, I think, is that for the purposes of the progressives within the coalition today, they were promised so much out of Build Back Better that I just don't think they're going to be able to get it out of a piece of legislation that has Manchin at the center. That being said, I do think it would be wise for Biden to try to do that, to try to get them to come along on something that is still a massive package that wouldn't be to the level perhaps of their liking, but would still achieve a lot. The problem is they wanted to get everything out of this. They wanted to do an FDR level, Green New Deal level type of approach when it came to BBB. I think, unfortunately, that they're going to find that the left is willing to basically say, you know what, we believe we're the future, that we're going to be around for a long time, and that we're not going to be beholden necessarily to a Manchin-directed future if we just wait long enough. And that's something that I think is going to be a real question in the next year. Carville is smart enough to know that they need something massive in order to perhaps redirect things politically. But even if they do that, I'm not sure that that's going to be successful because they've been such a failure in so many different respects, and I'm not sure that Manchin's own proposal won't end up just being something that politically does not connect with the American people or make their lives better in time to redirect policies and redirect the politics of the moment headed into the 2022 midterm.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.